Hello and welcome. Today we're delving into a rare and complex condition known as Post-pneumonectomy Syndrome, often referred to as PPS. This syndrome affects individuals who have undergone a pneumonectomy, a surgical procedure involving the removal of an entire lung. We'll explore its causes, how it affects the body, and what can be done to manage it. The primary cause of post-pneumonectomy syndrome is the radical anatomical change that results from removing an entire lung. This creates a significant imbalance within the chest cavity. The remaining lung and mediastinal structures, which include the heart, major blood vessels, trachea, and esophagus, shift to fill the void left by the removed lung. This shift is what ultimately leads to the symptoms of PPS. Let's understand the pathophysiology. Following a pneumonectomy, the mediastinum shifts towards the side where the lung was removed. This shift causes rotation and compression of the remaining lung, leading to increased pulmonary vascular resistance. It may also narrow the trachea and main bronchus. Over time, the rib cage on the affected side can collapse inward, further compromising the remaining lung's function. All of these contribute to development of respiratory symptoms. Post-pneumonectomy syndrome is a relatively rare condition, because pneumonectomies are performed less frequently now due to advances in lung-sparing surgeries. PPS incidence is also declining. It's most commonly seen in patients who had pneumonectomies performed in childhood or adolescence, as the developing chest wall is more pliable and susceptible to deformation. However, adults who have undergone pneumonectomy can also develop PPS. The signs and symptoms of PPS can vary in severity, ranging from mild shortness of breath to significant respiratory distress. Common symptoms include progressive dyspnea, meaning difficulty breathing, exercise intolerance, chronic chest pain, scoliosis, and a noticeable change in posture. Some patients may also experience recurrent respiratory infections, wheezing, and cyanosis, a bluish discoloration of the skin due to low oxygen levels. Diagnosing post-pneumonectomy syndrome typically involves a combination of clinical evaluation, imaging studies, and pulmonary function tests. A thorough physical exam will reveal the characteristic chest wall deformity and mediastinal shift. Chest X-rays and CT scans can visualize the anatomical changes, including the collapsed rib cage and compressed remaining lung. Pulmonary function tests help assess the degree of respiratory impairment and airflow obstruction. While there isn't a formal classification system for post-pneumonectomy syndrome, the severity of symptoms can be categorized as mild, moderate, or severe based on the patient's functional capacity and the degree of respiratory compromise. Factors like the age at the time of pneumonectomy and the extent of mediastinal shift also influence the severity. Treatment for post-pneumonectomy syndrome is primarily focused on managing symptoms and improving lung function. Physical therapy and postural exercises can help improve chest wall mobility and breathing patterns. In severe cases, surgical interventions may be considered. These can include thoracoplasty to stabilize the chest wall, mediastinal repositioning to shift the organs back towards the midline, or even implantation of prosthetic devices to restore thoracic volume. Oxygen therapy can help manage hypoxemia. Management should be personalized, based on the patient's specific symptoms and the extent of their anatomical abnormalities. Unfortunately, there's no definitive way to prevent post-pneumonectomy syndrome after a pneumonectomy. Early detection and proactive management of symptoms are essential. Careful patient selection for pneumonectomy, favoring lung-sparing procedures whenever possible, can minimize the risk. Postoperative pulmonary rehabilitation can help maintain lung function and chest wall mobility. The prognosis for patients with post-pneumonectomy syndrome varies. While some individuals experience a stable condition with good quality of life, others may face progressive respiratory decline. Recent research is exploring novel surgical techniques and prosthetic materials to improve chest wall stability and mediastinal positioning after pneumonectomy. Studies are also investigating the role of growth factors and regenerative medicine in promoting lung regeneration and improving pulmonary function in these patients. Continued research offers hope for improved outcomes and a better quality of life for individuals living with post-pneumonectomy syndrome. Thank you for joining us.